Hi, my name is Stacy Fappel, and I'm going to tell you a little about myself. I've been an LPN for 8 years, and I've worked in long-term care, assisted living, and home health. I'm really excited to say that this December I will graduate from the University of Missouri St. Louis with my RN BSN. So the reason I chose nursing was to help people, job security, and advancement, as well as to make a good living. So the reason I want to work here is because I love wounds. I fell in love with wounds while I was working in home health. I had a patient with a very large chest wound. I worked with him for about 4 months before it healed, but it was gratifying to be a part of that healing process and be able to help him get his quality of life back. So within the next 5 years, I could see myself working full-time with a woundostomy inpatient team and to get my certification in wound, ostomy, and continence. So if I was hired, I would bring to the facility reliability. I'm a team player, and I'm willing to learn new things to achieve the best patient outcome. So recently I had a stressful situation with a family member who cut her mother's toenails, which was my patient. She accidentally cut her toe instead, and she was on a blood thinner. So I cleaned the area, I applied a compression dressing, and transferred her to an emergency room for further evaluation for sutures and glue or glue. I also educated the patient as well as the family on the importance of proper foot care. And I referred her to the podiatrist who works within the facility. So the reason that this population draws me to it is because I love the feeling you get being a part of that healing, processing it from point A to point B. So my grandmother, she is a perfect example of actually having a deficit with self-image because she had bladder cancer and had a urostomy placed. That's another part of why I love this population, is to be able to help those people and reassure them that everything is going to be okay, no one's going to know, and be able to live their life to the fullest, which she did very well. So my best quality, I believe, is being able to relate to the older adult population. A lot of times people try to throw the older adults to the wayside because they're quote unquote old. But I don't see it that way. I want them to live their life to the fullest, to be able to do things until they no longer can, and then being able to help them until the very end. So some of the things that one thing that I can truly say that I struggle with is relating to the younger population. Because my experience has been mostly with the older adults, it's difficult to kind of transition to patients that are my age. But I'm getting better at it. I'm having more experience with the younger population, and it's going pretty well. So one of the things that I experienced that I had failed with was before I went to LPN school, I was trying to get into the RN program at St. Charles Community College. And unfortunately, one of their criteria is to get a 21 on your ACT, which I was never good at taking that test anyway. And I was 10 years out of high school. So a lot of the geometry and things like that was not in my head despite all of the studying I did. Unfortunately, I was never able to get that score of 21 after multiple attempts. So instead, what I did was I chose a different track. I went through the LPN program, and although it was a very long process, I can say that I'm going to reach my goal in December, and I will have my RN as well as my BSN. So as much as you don't want to report a coworker, if I had seen them doing something unethical, what I would do is I would have to report them to my immediate supervisor or follow the facility protocol, whatever that would be. Because ultimately, we're here for the patients and their safety. So if they're doing something that I witness and it's unethical, I will bring it to my supervisor's attention, or like I said, follow the facility's protocol on that situation, because I'm responsible for the patients. Whether it's my patient or my coworker's patient, it doesn't matter. If it's something unethical, it needs to be addressed immediately. So one of the likes of my most recent job is the ratio for nurse to patient. I believe it was easier to be able to give that quality of care to those patients with the ratio being less than other facilities. So I really did enjoy that was a lower ratio than the norm. One of the things that I disliked about the facility was the lack of accountability with call-offs. They have a point system for attendance, and they've had new management recently. So when they implemented the new management, they kind of lost track of the point system, and those folks who were calling off on a regular basis or doing no call, no shows were able to keep their job, and now they started back at a 0 points. So to me, accountability and reliability is one of the most important things you could be as a nurse and in the nursing field. So I look forward to meeting you soon, and if you have any questions, please don't hesitate to contact me. I will be available to you at any time. Thank you so much, and it was nice to see you and nice to meet you. Hope to see you soon. Thank you.